11:30 here this Wednesday. Hope you're enjoying this beautiful Wednesday down here on the Mornington Peninsula, across Frankston and across southeast Melbourne as well. Good to have you company. 98.7, 98.3. This is RPPFM, your local radio station. October, it's Breast Cancer Awareness Month. Breast cancer, I'm sure you probably heard the stats, absolutely terrifying, absolutely frightening. Second most frequently diagnosed cancer in women. Expected that more than 20,000 new cases of breast cancer will be diagnosed in Australia this year. Almost 1% of these, incidentally, will be males. 20% of women diagnosed are under 50 years of age. To tell us more and to bring us up to speed on this terrifying cancer, Dr. Nicole Yap, founder of Australian Breast Care Centre, is on the line. Dr. Yap, welcome to RPPFM.
Good morning. Isn't it a lovely day? But not such a bad day to be discussing about breast cancer, because this is the month.
Indeed. Well, you are very heavily invested in this, our awareness and our need to act. What do we do, and are we making any progress in its treatment, diagnosis and prognosis for those that are being seen by their doctors?
Well, that depends when you present with symptoms, because if you present early diagnosis is the key, and the prognosis following early diagnosis these days is in 5 years in females is 91%. So we want to keep it like that, and even more so if we can bring it up to 96% if we can treat the disease in its early stages. So, and that's why I like to push this message.
So indeed, so early detection absolutely a key. I guess it's probably pretty key in any major disease, Dr. Yap. Is that right?
Yes, that is true. That is true. With anything in life, if you catch it early, there is less treatment that is required. But my focus really at this point of time is in the younger age groups, which in breast cancer terms is less than 50 years of age, because these groups, as you rightly said, comprise at least 20% of all breast cancers diagnosed, and they tend to be in younger age groups a more biologically aggressive cancer, and even more reason to get to it early.
And indeed, I guess with that diagnosis as well must come the impact, not only, of course, on the physiology as the patient has to cope with that diagnosis and then the treatment, but also, I guess, for a younger woman, the prospect and the impact on mental health as well.
Absolutely. You hit the nail on the head, because I have to say that a lot of women don't present because they're very concerned about the outcomes, the surgical outcomes, the chemotherapy outcomes. And so, in other words, they're worried about how their appearance of their breast will look following surgery. And I'm an oncoplastic surgeon, which means I treat both the cancer and the reconstruction at the same time. So essentially, depending on how you present initially, you could easily have an incision that just is hidden under the breast, have the whole breast removed, and have an immediate reconstruction, and wake up feeling relatively normal after the breast cancer is removed.
We're speaking here to Dr. Nicole Yap, founder of Australian Breast Care Centre. Nicole, then what measures and what are you equipping patients with enough knowledge to self-diagnose before they come down and get into your rooms? I mean, is there enough information out there for younger women especially to be able to diagnose or think, my goodness, that doesn't feel right, I've got to get down and see somebody about this?
Yes, well, I think just the basic awareness that, because some people, especially in the premenopausal states at less than 50, do have lumpy breasts at some stage during their cycle, and they just need to know what's normal for them, and anything outside the normal, obviously a lump that stays, and especially in pregnancy, 1 in 3,000 pregnancies can be diagnosed with a breast cancer, so don't just take a lump there as a possible duct that's blocked. You need to assess it properly if it doesn't go away within a couple of weeks. And these are the sort of things you have to look for, including lump, which is nipple discharge, especially bloody nipple discharge, nipple retraction, so the nipples being pulled into the breast, and any contour changes of the breast, including dimpling, and it possibly even though an eczematous rash across the nipple areolar complex may indicate cancer underlying this area.
Now, tell us about one of your new methods of diagnosis. You are offering, I believe, an individual test to patients that present at your rooms. Is that right?
Oh, well, through the Australian Breast Care Centre, and you can look that up on its website with .com.au, you'll find that there is, I've worked in conjunction with Genetic Diagnostics, which is an arm of Dorovich Pathology, and I think it's really important for younger age groups that have a family history, especially people affected in their younger years, within the family I'm talking about, with breast cancer. If that's the case, then genetic testing may be really helpful for not just treatment options, but if they to avoid getting a breast cancer, because what we look for with this offering free genetic testing that looks for 12 mutated genes, which are usually breast cancer suppressor genes, which have been damaged. And they can be hereditary or they could just occur sporadically, but generally hereditary. So if we know that a patient has this, then we can offer them prophylactic surgery potentially, or at least a much more tailored approach to the management of their breast issues. So this is before they develop a cancer.
And also before presenting perhaps or getting themselves familiar with what is going on in this area, you, I believe, have put together a 10-part series which is available online in which you explore some of these issues with some of your patients, their stories and their outcomes.
Oh, yes. So you'll be able to see that on the same website. So I did this because I decided that no one takes any notice of me. So there's no point me waxing lyrical about, oh, this will be okay, you need to do this and you need to do that. I think it's better to come from the horse's mouth. So I decided to get the patients that have been through certain aspects of breast disease to come and retell their story of how they felt and how they empowered themselves and by doing that they had a very good result. And I think that's really important for people who might feel they have the same issues. They feel more inclined to want to present because they can see that there's a really good outcome. And if it comes from someone that's been through it, they can relate to them.
Absolutely. Where do they find that information, Dr. Yap?
So if they look up www.australianbreastcarecentre.com.au, they'll be able to see all these episodes which have been rolled out during the month of October.
We're speaking here to Dr. Nicole Yap, founder of the Australian Breast Care Centre. Dr. Yap, we're hearing a lot about new science, technology, the intervention into genetics and so on, ability, science and technology. What are the latest developments in the treatment of breast cancer in this area as well as we get more invasive and we understand more about the dynamics of this cancer?
Well, understanding the dynamics allows us to tailor the treatment, and we are getting more and more targeted treatment. So everyone's heard of chemotherapy. Chemotherapy is essentially a group of drugs which try to kill off rapidly dividing cells, and that includes cancer cells. But it also includes bone marrow cells, which are normal, and that's why a lot of people get quite unwell during chemotherapy because their immune system is compromised. So with the new targeted treatments that we have, because we know more and more about the biology of breast cancer, we are able to have less side effects because they attack certain aspects of the cancer in either its hormonal response or how it develops, for example, rather than affecting all the other cells in the body which are normal. So this is a great help to patients because they don't have such severe side effects, and especially the ones that women hate the most with chemo is loss of hair.
Indeed. So these are really, sort of to a degree, quite brutal treatments, or can be, in some of the the impacts and so on, the side effects. So I'm just wondering whether we're living in a new technological medical age, in which perhaps we're beginning to realise that the intervention and treatment of breast cancer going forward in the next generation or so is going to be remarkably improved, and that we will get a better sense and understanding at a much deeper level of the cancer.
Well, I certainly hope so, because at least then people will present earlier because they won't feel so afraid. But there are other things that are on the horizon, such as a blood test that may detect that you have an early breast cancer arising before symptoms occur. And it also means that you don't have to undergo mammograms, which aren't very good in very dense breast, because the sensitivity is less. And as I said to you, the incidence in younger age groups which have dense breast tissue is rising. So that's one good thing. The MRI, which is magnetic resonance imaging, is also another approach that is very good at diagnosing breast cancer. It's about 98% sensitive for diagnosing these lesions. But the problem with that is, in Australia, that the rebate is not is not given to a lot of groups of women that do need it, and it's quite an expensive imaging modality if you don't get any rebate from it. So that means that a lot of people, in fact, just yesterday, I saw a patient and offered her the MRI, and she said, I just can't afford it. So we went for a lesser approach of management, and that was because she didn't fall into the rebate category. So there's not just the technology that's around, but we also have to try and make the government aware that these sorts of technologies will improve outcomes, and hence the public dollar is less, rather than thinking about the current situation. Oh, we're not going to rebate or give a rebate to certain modalities such as MRI breast for more people.
Well, the takeaway from this month, October being the Breast Cancer Awareness Month, is that awareness. Presentation is absolutely critical very early in the piece so that diagnosis can get underway.
Yes, and I have to say that, having complained a little bit about the government not giving rebate, your member down at Mornington, Greg Hunt, who is also the Federal Health Minister, is very much aware of what's going on with the Australian Breast Can, and endorsed our genetic testing just recently. So you'll be able to see his message also on that website. And so I'm very grateful to him for recognising these issues in younger age groups.
Well, it's going to be a bit of a recurring theme here today, because after the news at 12, we're going to be speaking to somebody that's organising some opposition to him in his federal seat of Flinders at the upcoming election. He is, of course, the Federal Health Minister as well. Dr. Nicole Yap, thank you very much indeed. Once again, if people are interested in getting in touch with you, seeing what you have, and maybe viewing that 10-part online series, where do they go?
So the 10-part online series is www.australianbreastcarecentre.com.au. But if they want to find out more information on me and other issues with breast and breast issues in general, not just breast.
Sounds like we've lost Dr. Nicole Yap, but we thank you very much indeed for taking time. Seems like she was just disconnected there. This is RPFM across the Mornington Peninsula. Unfortunately, we've lost her, but